Coming to the droplet transmission, droplet generation occurs oftenly during coughing, sneezing, talking, and procedures such as suctioning and bronchoscopy. These are the procedures where it generates the droplets. So, here we need to follow droplet transmission precautions, and these droplets, if they get deposited in the eye, in the conjunctiva or in the nasal mucosa or in the mouth, they can cause infection. So, what are you going to have in the droplet isolations? The first thing, you need to have a surgical mask prior to entry. I think this is the new thing has come in droplet. We did not find mask in contact transmission, we found gloves, we found gown there, but for the droplet you need to also have mask apart from the gloves and the gowns. No special ventilation, private room again is needed here. If you are able to cohort, then cohort the patient. Hand hygiene, again as I said, it is common for all the things, and residents use mask outside of the room. They should use, whoever is the visitors, even sitting outside they can use mask. The droplet precautions are performed. The first thing you are going to do again is hand hygiene before entering and leaving the room, and you are going to wear mask when entering the room, and even the dietary employees may not be allowed to enter into the room. So, droplet isolations, extra thing we have added here is the mask, and there is no need for special ventilation as what is required for the airborne isolations. The condition diseases requiring droplet isolations, if you see here, seasonal influenza, as I said in the previous module. One of the members suffering in our house from common flu, the other person will also get infected. Again, the transmission is either through droplet or through contact. Pandemic influenza, which come across H1N1 cases also. Meningococcal disease like Neisseria meningitis, Streptococcus pneumoniae, mumps, MRSA involving the lungs causing pneumonitis, and group A streptococcal throat infections and rhinovirus. These are the patients where you are going to implement the droplet isolation precautions. And also, if you see next half of the slide, how much duration of isolation is required, it is there. For that, it is very important, so that the infective period should be passed on. Otherwise, during that incubation period or infectious period, patient will be more infectious to others.